In this video you will know about the risk factors and the complications of diabetes. Risk factors of diabetes type 1. Infections caused by viruses. Infections caused by viruses. Type 1 diabetes is thought to be brought on by the Coxsackie, mumps, and German measles viruses. Race and ethnicity. Type 1 diabetes is more common in some ethnic groups. Caucasians appear more prone to type 1 diabetes in the U.S. than African Americans and Hispanic Americans. Geographically, those residing in northern regions are more likely to get type 1 diabetes. According to some theories, residents of northern countries spend more time indoors, especially during the winter, which puts them closer together and increases the risk of viral illnesses. Family history. If a family member has, or has had, type 1 diabetes, you are at a higher risk because the condition is inherited. Additional autoimmune diseases. Type 1 diabetes, as previously mentioned, is an autoimmune disease which causes the body's immune system to become hostile. Several autoimmune disorders may have a similar HLA complex, so having one of those ailments may increase your risk of developing type 1. Autoimmune diseases, Graves' disease, multiple sclerosis, and pernicious anemia may also make you more susceptible to developing type 1. Risk of diabetes. Risk factors of diabetes type 2. Family history. There is a hereditary component to type 2 diabetes. You are more likely to develop it if a member of your immediate family does, or has done. Race/ethnicity. It's noteworthy to note that the prevalence of type 2 diabetes has increased as some nations have gotten more westernized, and their lifestyle choices, particularly their food choices, have become more American. For instance, type 2 diabetes used to be uncommon in China. The prevalence of type 2 has increased as the nation has become more industrialized, with more people working in offices and fewer in the fields, and their diet has changed. Less physical exercise and higher calorie intake are characteristics of many Americans' lives favorable to type 2 diabetes. Age. The chance of having type 2 diabetes increases as you become older. Gestational diabetes. If you had diabetes before becoming pregnant, your risk of subsequently acquiring type 2 diabetes is increased. PCOS. Due to its connection to insulin resistance, polycystic ovarian syndrome, PCOS, also increases the risk of type 2 diabetes. Insulin resistance is one potential cause of PCOS, which causes many ovarian cysts to develop. If you have PCOS, you may be insulin resistant and at risk of getting type 2 diabetes. Diabetes complications. Type 1 diabetes complications. Short-term complications. Hypoglycemia and DKA. Hypoglycemia. Hypoglycemia is characterized by low blood sugar. It occurs when there is too much insulin, which means that you have taken, or given your child, too much insulin or that you haven't timed your insulin intake appropriately to coincide with meals or physical activity. Alcohol. Some drugs and medicines like aspirin are potential causes of hypoglycemia. The signs and symptoms of low blood glucose, hypoglycemia, are usually easy to recognize. Rapid heartbeat, sweating, paleness of skin, anxiety, numbness in fingers, toes, and lips, sleepiness, confusion, headache, slurred speech. 2. Diabetic ketoacidosis, also known as DKA. Diabetic ketoacidosis can be a significant complication of insulin deficiency and is occasionally the first sign that a person has type 1 diabetes. How does diabetes ketoacidosis occur? You can't use glucose properly or effectively when the body runs out of insulin. Your body starts to use fat for energy when there isn't any glucose available to fuel it. Ketones are produced when the body breaks down fat. If the problem isn't addressed, an excessive buildup of ketones in the blood can cause the blood to become acidic and result in diabetic ketoacidosis. The signs and symptoms of DKA are usually easy to recognize. Weakness, confusion, cold skin, excess urination and thirst, abdominal pain, fruity breath smell. Long-term complications. Long-term complications includes two types of complications. Microvascular complications, eye, kidney, and nerve disease. Macrovascular complications, heart. Eyes. If you have type 1 diabetes, your eyes could develop cataracts or retinopathy. Although cataracts are significantly less prevalent in type 1 diabetes than retinal impairment, both can result in vision loss. Kidneys. If kidney disease, diabetic nephropathy, is left untreated, dialysis and/or kidney transplantation may be necessary. The kidneys will probably eventually stop functioning because of uncontrolled, or improperly regulated, diabetes because they won't be able to properly remove waste from the blood. Nerves. Diabetic neuropathy is the term used to describe nerve damage brought on by diabetes. Your nerves are fed by microscopic blood vessels, therefore, if the blood vessels are injured, the nerves will also be affected. Heart. Large blood vessels can be impacted by type 1 diabetes, which may eventually lead to plaque buildup and a heart attack. Complications of diabetes mellitus, type 2 diabetes complications. Short-term complications. Hypoglycemia. Low blood sugar is known as hypoglycemia, blood sugar. HHNS syndrome. Although hyperosmolar hyperglycemic noncatotic syndrome, HHNS, is extremely uncommon, you should be aware of it and be prepared to respond if it does happen. You could lose your life if you don't treat HHNS, which occurs when blood glucose levels spike dangerously high. Long-term complications. It includes microvascular complications, eyes, kidneys, nerves diseases. Macrovascular complications, heart, brain, and blood vessels. Eyes, cataracts and/or retinopathy in the eyes can result from blood glucose levels that are out of range for an extended time. Both can result in eyesight loss. Kidneys. If kidney disease, also known as diabetic nephropathy, is left untreated, it can compromise kidney function and necessitate kidney transplantation or dialysis. Nerves. Diabetic neuropathy is the term used to describe nerve damage brought on by diabetes. Your nerves are fed by microscopic blood vessels, therefore, if the blood vessels are injured, the nerves will also be affected. Heart, brain, and nerves. Type 2 diabetes can impact the big blood vessels, resulting in plaque buildup that may eventually result in a heart attack, stroke, or artery blockage in the legs, peripheral vascular disease. If you want to know more about diabetes, then click a link below.